She did mention that you felt like there's just from the top all the way down into your back. You're feeling
some burning sensation.
Like a burning sensation?
All the way down.
And let it go. There it is. Good job. There it is.
Hey, yo.
You said the lower back is the biggest issue, correct? Can you show me where you feel it at?
Right here. Well, this is where it all started. Right
So
here.
it's right in the center here. Okay. And then in regards to where else you're feeling it, I know she was saying in your shoulder, correct?
Well, the shoulder started recently. It's going to be 3 months, and
3
it's
months.
just been a lot of pain. But
Okay.
I do feel the pain coming from up here.
Okay, so it's kind of more so from where again?
So right here.
Okay, from the top here.
Yeah, and it just, all this hurts right here.
Okay, she did mention that you felt like there's just from the top all the way down into your back, you're feeling like some different sensations.
Some burning sensation.
Like a burning sensation. Now you feel like it's from the top of the neck and it's kind of working its way down?
Yes.
How far down do you feel?
All the way down.
All the way
all
down
the way
into
down.
the leg. Is it
Yeah.
more on the left side or is it both sides?
It's on this side.
Just on that left side there. Okay. And how long have you felt that for?
Oh my God, for years.
Okay. Years as in like 1 year, 2 years, or years as in like 5 to 10 years?
I want to say like 10 years.
10 years? Okay. And the lower back, I think she says that's been going on for several years.
Oh my God, yeah, like in my early 20s.
Okay. She said that you were in an accident some time ago, but that was...
Yeah.
you
That was
had
in
this
2000, I want to say 2004, around there.
Okay. But you had the back pain before...
Before that,
Okay.
yes.
So let's, real quick, I'm just going to be looking at your spine here from the back here. Now, right off the bat, we're going to see a tremendous amount of swelling on this upper back here, okay? Now, just kind of going from the back here, okay. So looking at the shoulders, so this side it kind of flattens out here. This side you have a little bit of a rounding over here.
That's where it hurts.
Yeah. All right, so yeah, so we are seeing, yeah, a lot of pressure up on that top. Do you get headaches at all?
Yes, I do.
How often do you get headaches?
I want to say maybe twice a month.
A couple times a month?
Mm-hmm.
Yeah, so you have a lot of pressure right in this area here too. Okay, so what we're doing is we're measuring for inflammation. So when you damage a joint or injure the spine, let's say you rolled your ankle, right? When you roll your ankle, you damage the tissues and the ligaments and the joint, and you're going to get inflammation, so you're going to get a lot of pain. You're going to get some swelling because a lot of fluid rushes into that joint. And then you get some heat that radiates to the skin. And so the heat on both sides of the spine should be relatively the same temperature. But when the joint's inflamed or irritated, oftentimes we're going to see a difference in the reading. All right, so here we have the tailbone. This is your S1, and then your S2. S1, S2. Any pain on there?
Both.
Both of them. Okay, which one would you say is the worst of the two? 1, 2. Seems like one's where...
Maybe one, yeah.
Yeah. Then we have one up the very top of your neck. This is around your C1, C2 area. Okay.
Oh, right there.
Which one? Here on the left?
Yeah.
So more 2,
Yes, right there.
more 1.
Oh my God, no, one.
1 a little
Yeah.
bit more. This is your spine from this side.
Okay.
Your L5, you see how it's kind of sitting back like that? When it sits back, you see how it's kind of causing you to come back this way. So instead of like a nice S-shape kind of curve, you have kind of like a C shape. And that's because you have what's called like a sway back posture. When it sways like this, then your body starts to hunch over. So we're going to try to push this thing forward to try to get your body to come more upright. So if we can set that back where it needs to be, that will help to change the projection of your spine here. Now, we also see some stress up onto the upper back here. We're going to start with your T3 and see if that's going to work out. But your C2, this one, it has a tremendous amount of rotation, so it's rotating and it's causing a lot of that stress on your upper part of your neck here. Okay, so we're going to start with your C2. We might need to go up after we work on C2 to correct what's going on with C1 later, but we're going to start with your C2 and see if I can get some pressure off of that to see if we can alleviate some of that pressure. Okay. So when we do the adjustments, sometimes you will feel some of the popping noises. Okay?
Right.
So that's just gases in the joint, so whether it be your toes, your knees, your knuckles, or your spine. the joints everywhere in your body, they have gases in them. So when we shift those joints, sometimes those gases, they get released, and that's what you hear the popping noise, okay? So we're not cracking any bones, breaking any bones, or just shifting the joints, okay? Well, let's get you started here. So we're gonna go on to that L5 and get some pressure off of there to see if we can get some relief here. So we're gonna go ahead and ride on over here. I don't want to twist you like a pretzel here. We're going to roll you the whole unit here. Your whole body's going to come over. Oh, there it goes already. It really wants to move here. And I won't let you fall, so just try to relax, okay? I haven't let anyone fall yet. I won't let you be the first, okay? Let that shoulder relax. A little bit of a push, just like that, okay? Let it. There, you're doing so good. Oh, nice job on that one. We're going to walk on that for a little bit. So let's get you walking towards the door. You're going to walk over this way. Walk back over to the chairs. And how are you feeling on that? What's it feel?
It feels good.
Yeah?
Yes.
Good. Right on over here. There's your T3. Deep breath for me. Let it go. Drop in the shoulder. Nice and easy on that. Good job. We got one more. We're going to go up to the upper neck. I want to take a look at how we're going to do that here because it's really rotating to the left here. So I'm going to rotate there and then rotate here. Yeah, you go way further to that.
Oh, yeah.
Going over here gets really jammed right there.
Mm-hmm.
Now roll over to the right and then to the left. Okay, so we're going to take it from this right side here. I know you feel a lot of the stress on that left side. Mm-hmm. The reason why I'm taking it from the right side is because what happens is that joint, it's rotated to the left, but then it's wedged this way. So we're going to see if I can shift it and move it back to the right. Okay. So you're going to lean on back. Bring up your right arm. There you go. Arm down. Now the seatbelt's going to keep you nice and stable because when I do the adjustment, I don't want the whole body to move. I just want your spine to move here, okay? All right, good. We're going to lean you just a little bit further. There you go. All right. So I'll walk you through everything that we're going to do. I don't want you to feel any nervousness or anything like that. You're going to be just
that's what
fine.
I kind of do.
I know, yeah, Sam told me about that. And so just so you know, we see a lot of different types of patients in our office. So far, everyone's walked out pretty happy when they leave out the door, okay? So you're going to be one of those people as well, okay? Just allow your body to relax. Let your shoulders relax. Let that stress leave the shoulders, down into the arms, into the hands. Put that stress into the legs, down into the feet, and let it go out into the floor. Right there's perfect, just like that. And a little bit of a push, okay? Ooh, nope, I need a little bit more of a push there. One more, okay? There you go. Right there. Drop that shoulder. There you go, just like that. And let it go. There it is. Good job. That's going to get you walking one more time, okay? So let's have you walk over to the wall, back over to the chairs. Now, a lot of times when we do that upper neck, sometimes people can have a pretty good response in the sense of like, well, sometimes there can be a little soreness with it just because it's pretty inflamed there.
Yes.
Yeah, other times people can really feel like almost like a release of tension. So when we go in and shift and move it, sometimes that discomfort can actually settle in, but then it will start to dissolve over time. So the more we get movement, the better it's going to be. So let's have a seat. Let's go and re-scan you here. All right, let's see what we got going on up here. Good. So it's definitely better. It's changing. That's a good sign. Yeah, so that's doing much, much better here. It does still have a little bit of pressure on that. We're going to leave that alone though, because your L5 looks like it responded pretty well to that, okay? So when you come back in next time, we're going to reassess how you're doing on your L4. If that needs to get worked on, we'll move up a little bit. But that L5 looks like it's clearing out pretty well, okay? The body, when it shifts out of position, your body develops like, kind of like that's its normal, new normal, right? Now we're trying to recreate a different normal, right? So when we go in and try to shift those joints to get into position, your body was so used to the old way. Now it's got to get used to the new way. So when we go in there and try to correct some of that stress, now your body can kind of go through some motions here. Sometimes people feel like, oh my gosh, I feel so great. Other people are like, oh, it's kind of sore, a little tense. That's okay, okay? If you feel any soreness or discomfort, ice is your best friend, okay? Ice, 15 to 20 minutes, get an ice pack, put a paper towel around that, ice those areas if you need to. As you get movement, walking is your best form of exercise, okay? So the movement started in the office, it continues outside the office, okay? That's gonna be the best, all right?